Okay, ladies, it's bound to happen. The skin on your body, it can't defy gravity forever as hard as we try. You can hide a lot of things in clothes, but when it comes to your face, it's not so easy to hide. But if it bothers you, then there is something you can do about it. Dr. Thomas Kotoske, he is the medical director of the Cosmetic Surgery Institute and Body by Kotoske. Good to see you.
Nice to see you.
You are here to tell us about this new concept that's really changing women and how they look, taking them 30 years younger, if not even better than they looked. You know, I say 30 years, but back when they were in their 30s. So it's called Quick Lift. What is that?
Quick Lift is a minimally invasive facelift that has very minimal downtime, very minimal pain, with a very quick recovery.
Right.
And it's very powerful, long-lasting and so forth. But we can do these types of procedures in conjunction with other modalities and get patients right back into their normal functions.
What I
quickly.
love about it, it's a liquid facelift, right? Is that kind of what it is? Is that the concept behind it?
Well, the Quick Lift is actually a surgical procedure, but we have a liquid facelift that we do that's a little more minimally invasive, that involves fillers, Botox, to basically ward off the surgical piece of it, and then we move on to the surgical end, which is the Quick Lift.
Okay, so there's two different things here.
Absolutely.
So the liquid facelift is for those who don't want the surgery.
Exactly.
And then if you want to go a little further.
Right.
So who's a good candidate for both different treatments?
Well, when we think about people that are embarking on cosmetic surgery, women specifically, we'll talk about, it could be 20 to 70-year-old age group. In the 20s, we're looking to maybe enhance our lips, take care of nasolabial folds, take care of wrinkles, maybe even do more of a preventative type of situation with Botox. We see that, and then as we begin to age, we move more towards the surgical end of it because of changes in elasticity, loss of tissue volume, so we would embark on maybe a lift of some sort.
I see, so it really just kind of depends on where your face is when you decide
to
do something about it.
Exactly.
All right, so let's walk through the procedure, if you could. Let's walk through the Quick Lift procedure.
All right, so the Quick Lift is basically a procedure where we make a little incision around the ear. We're able to do a little liposculpture in the chin area, but we then raise the muscle tissue back up into its original position. Do a beautiful plastic closure, and patients are healed literally within a week or so. They're back to their normal progression.
And one of the things that I love about you, and I've seen your before and afters, and you're about to see them as well, you believe in natural. You don't want people to look like they've had something done.
Absolutely. I mean, I like age appropriate. I love the natural look. I don't like the plasticized look. We're not trying to sell that. We like to erase wrinkles, take away the signs of aging, but keep people very age appropriate with what we do.
All right, so let's look at some before and afters, and if you don't mind, if you could describe for us what you did for each patient.
This patient had the Quick Lift, which is basically removal of some skin from the neck region, taking care of the nasolabial folds, the cheek pad, and so forth. Very minimally invasive with the approach, and she was a school teacher. She was back to work very, very quickly.
She looks great. And and you said the results are, I mean, the downtime is pretty
usually
minimal,
8 to 10 years in terms of the time period. And that's with all facelifts. But this is another gal. That's literally 2 days out from her original surgical procedure. It incorporated liposuction. It incorporated movement of the muscle.
Incredible.
Yeah, she is a beauty.
Oh my gosh! And look at this one.
This is a multiple modality, meaning we did her eyes, we did nose, we did the lift. I did use some fillers on nasolabial folds and took care of the overall face, but it was a multi-modality type procedure.
And then we're going to show two more, which are just the filler before and afters.
Sure.
What is the recovery?
On a filler, let's say we're doing the lips for lip enhancement, you're basically talking 24 to 48 hours with a little bit of swelling. You're able to get back to work very, very quickly with that. Here we were treating the nasolabial folds with a filler. And very soft, nice, result and so forth, but back to work literally within 24 to 48 hours.
But you even said with the Quick Lift, the recovery is pretty minimal.
Oh, very much so. Very minimal pain, not taking major pain medication after 24 to 48 hours.
The before and afters are absolutely amazing. I know those ladies are thrilled. Okay, Dr. Kotoske has brought along a liquid facelift special just for you today. You'll receive $1,000 off complete Bellafill kit, a 20% off Juvederm and Voluma, and 15% off Botox, but you will need to mention the Sonoran Living Special for those as special rates. The Cosmetic Surgery Institute Body by Kotoske is located at 19636 North 27th Avenue. That's in Suite 101 in Phoenix. Call 623-516-2639 to book your appointment today or visit bodybykotoske.com.